in Nur Manzil Psychiatric Center, Lucknow. One of the illnesses that I'm commonly encountering in my practice, which is as incapacitating as the chronic illnesses like schizophrenia and bipolar disorder, is obsessive compulsive disorder. This consists of repetitive thoughts which are associated with a lot of anxiety. Now, these thoughts could be related to cleaning, the person feeling that they are contaminated, they are dirty, associated with compulsions like washing. There could be doubts which make the person check again and again. There could just be intrusive thoughts. There could be this need of symmetry. There are different patterns. But what happens is that the person takes a lot of time to do their activities of daily living, and these intrusions are associated with a lot of anxiety. They understand that these things are actually irrational, yet they cannot help it. So this causes a lot of problems with their family members, lot of water shortage, lot of loss of time because they cannot finish their exams, their schoolwork, they cannot get out of the house because they are checking. It's important to understand that there are lots of treatments available for this very common condition, and people can actually be helped by it. There are medications which if given in proper doses can help the patient significantly, and they are safe, effective, and not very cheap, but they've got to be given for a fairly long period of time. Along with medications, there are lots of therapies, behavior therapies like exposure and response prevention, like cognitive behavior therapies, which can be done in the clinic and which can also by way of homework assignments, they can, with the help of family members, they can be performed at home, and this multimodal form of therapy can actually help the patients to get better and have a sense of empowerment. It's important to note that people actually understand that they are irrational or they are having excessive thoughts about these things, but they just can't help it. So scolding them or keeping them away actually makes them more anxious, which might sometimes result in a lot of aggression and difficulties with family members or at the workplaces. Some people may be very good at hiding all these things, but this is associated with a lot of anxiety. It's probably the fourth commonest mental health problem after depression, alcohol, and other substance uses and phobias, and it can be quite incapacitating. But the good thing is that treatments are available and people can approach mental health professionals for different kinds of therapies.